I want to shift this conversation now to Dr. Hiral Tipirneni. She's an emergency medicine physician and a former Arizona candidate for Congress. Doctor, you were just hearing Anjali go through, giving us a pretty sobering picture of what we're dealing with now in the United States. And it feels as if we've all been pretty distracted from the virus given the elections. I'm wondering if you think that we really should be far more alarmed now in November than we were, say, back in April when we were all in lockdown and staying in our homes.
Yeah, well, Kristen, it's good to be here with you. I wish the topic was certainly less dire, but yeah, I mean, look, here we are. What is it? 8 months into this, and obviously, I understand that there was a steep learning curve at the beginning, but we know how to mitigate the spread of this virus. We know this because not only have we seen it work, and bringing down surges, but we've seen it what has worked in other countries. And the fact that we are now seeing additional surges, we are seeing all of these hotspots where, as your prior guest just mentioned, restaurants, bars, gyms, cafes, all of these places where it is just not feasible to maintain the public health guidelines that are necessary to prevent further spread. We have to make some really hard and thoughtful decisions, and it has to be based in the data. Because we know that so much of this could have been prevented. We are at a place where, as you mentioned, over 10 million cases here in the States. We have one state, Texas, that has now itself exceeded 10 million cases. Here in Arizona, we have over 6,000 deaths. So much of this was preventable. And if we haven't learned the lessons of our past 8 months, then it is going to be a very dark winter.
So, how bad is the picture getting really here? It feels as if we're almost okay now with living through this pandemic, but really, how bad is it? You are an emergency room physician. So, how bad is it inside the hospitals? How bad is it when it comes to the supplies? How bad are you seeing it personally, firsthand, getting when it comes to the deaths?
Yeah, I mean, look, I've been speaking to so many of my former colleagues who are out there working on the front line still, and the numbers continue to creep up. They are worried about, resources, right? ICU beds, ventilators, but it's not even just the equipment. I mean, you have to have healthy staff. You have to have nurses. You have to have respiratory technicians. You have to have all of the team members that are going to be able to fully care for these patients. And we are seeing a level of exhaustion on healthcare workers' parts, on the resources. Back in the summer, our state, we had to go into, at one point, entertain the emergency care guidelines, which would have essentially had us rationing care. I mean, we should, at this point, have better protocols in place and enforce them so that we are not at risk of going back to that. I mean, here in Arizona, we don't have a statewide mask mandate. We're still debating the use of a mask, as I think one of the other guests mentioned. This is not up for debate. It is no longer up for debate. The science is clear what is going to help us get out of this pandemic. And those guidelines have to be enforced. They have to be followed widely. And it is a, all hands on deck situation. And we cannot afford to become lax on this. And now with cooler temperatures, more people indoors, limited ventilation, flu season upon us, all of these are confounding factors that, if we do not address them urgently, will make this incredibly worse.
So, to that point, you just mentioned winter, the flu season. We also have the holidays. We have Thanksgiving coming up, Christmas, Hanukkah, the New Year coming up. Do you think if we continue on the path we are on now, which, as you mentioned, we do not have a national mask mandate? We see folks, at least a couple of weeks ago, were attending rallies without any masks, crowding together very close together. And of course, people want to get together with their families, with their loved ones for the holidays. So if we continue to do what we are doing now, if something does not change, where do you see us in February after the holidays are over? We're having case counts up over 120,000 cases in just one day. Are we headed for some kind of doomsday scenario where we might have 250,000 cases in a day?
Yeah, and I mean, look, this is about facts, right? We're not fear mongering. We're giving the facts. We want people to take this seriously. And the data is clear that if there continues to be exponential rise of cases, then that is where we will find ourselves in the spring. But we also have mitigation strategies that we could implement. We could continue to invest in widespread, further expanding our testing capacity. Right now, we still are not at the testing capacity we should be at. We don't have rapid results of our testing. We don't have contact tracing infrastructure in place. We don't have a mask mandate. We are still having, these non-essential businesses that are open. And I don't take that lightly. Obviously, people need to have jobs. But if we are putting them at risk and putting their families at risk and their communities at risk, it is not a trade-off that any of us should be willing to make. And it is scary when you think of the fact that we are getting somewhat numb to these numbers, right? When we hear of thousands of people dying, we have over 1,000 that die a day. And the fact that we are still debating whether we should wear a mask, it's unconscionable. And the way we're going to make sure we really address this head on is to make sure our leaders take charge. Leaders need to lead by example. There should not be a single leader out there that at any point is out there in public with other folks without a mask. They should be emphasizing the importance of staying home as much as possible, of washing our hands, of getting tested, of investing in this kind of infrastructure, making sure we have adequate PPE. All of these things are factors. And, we heard some great news recently, right, with this vaccine potentially being very effective from Pfizer. Well, that's wonderful, but let's now put in a plan of how will we mass produce it? How will we mass produce the needles, the syringes, manufacture it? What does our supply chain look like? What about distribution? Who are the populations to receive it first? All of these are critical decisions to be making now so that we are ready when the time comes.
All right, Dr. Hiral Tipirneni, emergency medicine physician, thank you so much for joining us today.